My name's Donna and I've had a series of under-eye filler injections which unfortunately became quite problematic with spontaneous swelling and various other issues. I went back to the practitioner several different times and each time I was just told that I simply needed more filler and that any irregularities that I might be seeing were part of my natural facial contour. I knew that this wasn't right and I did keep saying to the doctor that I felt it wasn't right and needed dissolving. However, the problem was being masked rather than dealt with, and more filler was just being added to mask a problem that was underlying underneath, unfortunately. After several dissolving sessions and refill sessions, I'm left now in a position where I have a bag under my eye and spontaneous swelling, which is still present from time to time.
So I think a lot of the elements of that story are actually really common, and the things I hear all the time from patients. The first thing to say is that swelling is incredibly common with fillers, and I think it's incredibly common particularly with tear trough fillers because the area is so unforgiving, and often you're just dealing with skin and some very thin tissue and then bone. So although fillers generally can attract water and swell up if it's in the cheek or the jawline, that can often be hidden and disguised, but it's just there's no way for that to hide in their very delicate tissue areas around the eyes. And I think that's unfortunately what you experienced. But we've got a fantastic set of MRI scans that we're going to look at.
Brilliant.
What we can see on the left side is that there's still quite a lot of residual filler left, which has not been fully dissolved, running up from the tear trough into the outer part of the cheek, which is where you're getting the swelling, and that aligns really well. And then on the right side, it's slightly different. There are fragments of filler in that very highly defined area of swelling, but we're also seeing a very large sort of swathe of filler running all the way around, almost incarcerating that area, which can affect the lymphatic drainage quite considerably. And what we know about the lymphatic drainage in that part of the eyelid and cheek is that it drains outwards and downwards along the face, and it's almost like a wall preventing that from happening. Can I just make sure that you're happy with that as well? Always ask the patient. The patient knows. Does that look about right to you?
Yes.
Okay, so we're going to use a blunt cannula technique. That means that you'll have feel some little pricks, okay, from a needle, and then we'll put in a blunt cannula which will stretch, which will.
Thank you.
Okay. Sometimes it's going to be a bit prickly trying to get this through the skin. Skin's pretty tough. Which is good. Okay, I'm going to do this in 2 steps. So deep breaths in and out for me. Well done. And we're doing a nice even distribution of volume. You okay? And it's good to get this to multiple layers and planes. So now we're going to do the remainder of the medial part, and Donna, chin up slightly for me. Well done. And deep breaths. Well done. Okay, and there we have it. This is the flooding technique, using a low dose, high volume to fully treat the area. And the area that we've treated has been very accurately matched to ensure that there's correlation between the patient's symptoms and the radiological findings. Okay, so we can do the same again here. Okay, and deep breaths again for me. And do it again at a very even and slow rate. And again in multiple planes, although the dissolving agent does diffuse through different tissue layers quite nicely. And we're almost there. Turn towards me now. Thanks. We're going to do a final little side here. So just complete this little bit now. Again, that's just the medial end, and then I will advance all the way through to the medial part of the tear trough, which is just here. And then a little small bit there medially. Okay. And we're finished. Well done. I know that's not very easy, but well done on tolerating it.
Thank you. So the dissolving procedure is all finished, so I'm really pleased that that has all been done now. Did feel a little bit different to how I've had it dissolved before. I think it felt a little bit firmer in pressure, and I felt that it was going a little bit deeper than what it had done previously when I've had it dissolved, as that felt quite superficial. Little bit sharp, not at all unbearable, quite manageable, and over with far quicker than what I expected. So I'm really, really looking forward to seeing what the results are.